this video, we'll turn to vocabulary building, using a setting of a first responder at the scene of a motor accident. By first responder, we mean the person or persons who are first at the scene of an accident, a natural disaster, or some health crisis, and who give first aid or basic life support to the patient until the patient is at the medical facility. And for many of us, the kind of life support, the kind of aid that we're familiar with is cardiopulmonary resuscitation. Now, even for English speakers, that is a mouthful. So we usually simply say CPR. So you would say, he performed CPR on the casualty. Perform is a verb that just sounds natural with CPR. And in talking about what first responders or healthcare workers do, there are certain natural sounding verbs that go with many nouns, and that is what we will look at, or at least a few of them, in this tutorial. So let's take a scenario of a motor vehicle accident involving 2 cars and 2 casualties. That is, 2 injured persons. Casualties. What are some of the things that a medical first responder, be it an emergency doctor or emergency medical technician, EMT, would do at a scene like this? Well, they check to see who's conscious or unconscious, who needs immediate care and who doesn't. They put in breathing tubes if needed, someone isn't breathing. They provide air or oxygen. They give fluids or drugs. They prevent the patient from going into shock, or they prevent fractures and other injuries from getting worse by protecting them somehow. Now, there are lots of other things that first responders do, but we're going to take a look at the technical vocabulary around these items here. So first, checking who needs immediate care versus who can wait is called triage. Triage. That is, you check who needs immediate help, who can wait, or who is beyond help because they're already deceased. Deceased or dead. So we say the first responder performed triage, or you can also say the first responder carried out triage. They also put in breathing tubes. First, they make sure that everything is clear and they put in a breathing tube so air can go in and out freely. We say they clear and establish an airway. Clear and establish are natural sounding verbs that go with an airway. And of course, they have to make sure that on the way to the hospital, air continues to move freely in and out, so they maintain the airway. But of course, you can give air in different ways. It can either be mouth to mouth. It can be by manual. It can be manually, which means you squeeze the bag by hand, or it could be a machine that breathes for the patient. And this moving of air into and out of the lungs, we say is ventilation, or the verb to ventilate. So, he established an airway and then ventilated the patient, maintaining the airway all the way to the hospital. So what else does the first responder do? They give fluids or drugs, for example, saline or glucose. You can say give drugs or give fluids, of course, but you can also say administer fluids or drugs. You talk about Stopping external bleeding by pressing down directly on the point when it's possible. Here we talk about applying pressure. So she applied pressure means that she directly pressed down on the bleeding point, usually by hand. Or if it is a limb that was bleeding, she may tie a band around the limb and pull it tight until the bleeding stops. And here we say she applied a tourniquet. A tourniquet is the name we give for that band that we tie around to stop bleeding. Now, fractures, when they first happen, of course, they move freely. The patient might be restless. You want to make sure that there are no bones flying everywhere or that the ends of the bones don't cause more damage to tissue. So you want to hold the fracture in place so at least it doesn't cause any more damage. And you do this by usually attaching it to a splint of some sort. So we say that you stabilize a fracture. Stabilize a fracture with a splint, which is the piece of stick or metal or whatever that you use to keep the fracture from moving around. Other natural sounding verbs in this scenario, so we talk about applying a splint to a fracture or simply splinting a fracture. That is also correct. Or you apply a plaster of Paris cast also to a fracture. Now note this is different from reducing a fracture. Reducing a fracture is what is done at the hospital after X-ray, under supervision of the surgeon, to make sure that the ends are in the correct place and are not causing a danger to other tissues. When the bones are put in the final place that they're going to be, that is called reducing a fracture. So here's the last quiz of this tutorial, and I'd like you to complete the spaces below with the correct verb. So when they arrived at the scene, the EMTs beep triage. One victim was unconscious, so they beep an airway and ventilated him. The other had bleeding from a deep cut to the thigh, and EMT beep a tourniquet until bleeding stopped. They set up IV lines on both victims and beep saline. Your answers should be: when they arrived at the scene, the EMTs performed triage or carried out triage. One victim was unconscious, so they established an airway and ventilated him. The other victim was bleeding from a deep cut on his thigh, and EMT applied a tourniquet until bleeding stopped. They set up IV lines on both victims and administered saline. So challenge yourself with more exercises like this and build your natural sounding medical English vocabulary. Bye! For more practice with this topic, you can download a free worksheet at promedicalenglish.com.